The main thing, there's a few. If you're a smoker, stop smoking. There's a lot of reasons to stop smoking. Sometimes the fear of going blind is something that would actually, kick someone over the edge to actually stop. So the other thing, there was a study done many years ago called the AREDS study, A-R-E-D-S. And the reason I spell that out is because there are vitamin companies that make vitamins for macular degeneration based on the AREDS study. And it'll be usually on a label. So a lot of times we'll recommend vitamins, usually an AREDS 2 formula vitamin.
So they have special vitamins that help protect the eye so that the macular degeneration won't progress as fast or much, or you'll protect the eye.
Correct.
Okay. They have to take those for a long time?
Rest of life.
Rest of their life. So if the macular degeneration progresses, are there two different kinds, and you're trying to fight off one, and how do you fight it off other than with vitamins?
Yes. So you're exactly right. There's two different general kinds of the macular degeneration. There's dry and there's wet. The dry form would be like the changes in the pigment that I mentioned.
So it's early changes is the dry.
So early changes.
Most common type?
Most common. Now, some people can have some pretty significant vision loss with the dry, but dry really means that there's no fluid or blood on the retina. The wet, of course, means that there is fluid or blood on the retina, and that can be very devastating if not treated.
So what do you tell people to do that have early macular degeneration other than vitamins? How do they test their vision? Is there a grid that they look at every day that I've heard people tell me about?
Yes, so there is something called an Amsler grid card, which is basically, it's a pattern, it's a grid with a little dot in the center of it, and people can self-monitor their vision by one eye at a time, look at that little grid. If they look at the dot, and that grid should look like a grid. And then they do the other eye, it takes 2 seconds, and if something has changed on that grid, then that would alert someone to come and be seen.
So how easy is that to detect? Is it bingo overnight? Does the patient call you immediately if they get that, or they wait till tomorrow, or what's the evolution?
It usually takes a little while, and it's not usually something overnight. And so it's not an absolute emergency. You have to be seen at 3 o'clock in the morning kind of thing, but you want to make an appointment and be seen soon.
Good. So what is the progression of macular degeneration, and can you treat the wet kind or can you treat the dry kind?
So there's no real treatment per se for the dry except for the vitamins. And like a lot of different diseases in our body, there's a wide range. So some people with mild macular degeneration never get worse. And then there's some that do progress. So one of the things, if someone progresses to the wet form of macular degeneration, that used to be a devastating diagnosis, and there were treatments, but none of them worked well.
So what do we do now?
So now there are injections that can be done inside of the eye, which sound awful, but really aren't that bad. And when it comes down to it, if you have a choice between going blind and having an injection in your eye, guess which one you choose?
And I know people that have had injections in their eyes, and they say it's not really bad. It sounds terrible, but they really say it's good. And that can save their vision